Is your pain coming from your hip or your SI joint? It can be hard to tell, but I've spent the last 15 years helping thousands of patients figure this out without surgery, medication, or expensive testing. In this video, you'll learn exactly how to pinpoint where your pain is coming from and what to do about it. I'll walk you through simple steps that anyone can follow, and by the end, you'll know if it's your hip or your SI joint and how to fix it. Plus, stay to the end of the video for my 3-step plan to correcting sacroiliac joint dysfunction. Let's get started. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. If you're busy with work or home life and are dealing with chronic spinal conditions, this channel is dedicated to you. Here you'll find exercises, expert tips, and proven strategies aimed at managing and preventing back and neck pain so you can stay active and pain-free. Before we dive in, subscribe to my channel if you want tips and strategies to help you achieve lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. Let's start by discussing the differences between hip pain and SI joint pain. First, what is hip pain? Hip pain typically occurs in the groin, thigh, or outer buttock area. It's often caused by issues like arthritis, muscle strains, bursitis, or hip impingement. Common symptoms include stiffness, reduced range of motion, and pain during activities like walking, squatting, or moving the leg in certain directions. Movements that aggravate hip pain include bending the knee or rotating the leg in and out. Now, what is SI joint pain? SI joint pain, on the other hand, originates from the sacroiliac joint, which is where the sacrum and the pelvis meet. It's usually caused by inflammation, injury, or dysfunction in the joint. Symptoms can include sharp pain in the lower back, buttocks, or upper thigh. Unlike hip pain, SI joint pain can worsen with standing, sitting, or walking for long periods and can even radiate to the legs. I go into more details about the symptoms and causes of SI joint pain in another video. You'll find the link to this video in the description below. While both types of pain can overlap, there are certain distinctions. Number one is location. Hip pain is more focused in the groin area and thigh, while SI joint pain is concentrated in the lower back, buttocks, and specifically at the location of the SI joint. Movements. Hip pain tends to worsen with leg rotations or squats, while SI joint pain is aggravated by prolonged sitting, standing, or walking. Radiation of pain. SI joint pain often radiates down into the legs and can mimic sciatica, while hip pain usually stays more localized. These differences will help you understand the source of your discomfort and guide the next step for treatment. Many patients come to my office complaining of hip pain, but when I ask them to point to the location of the pain, they almost always point to the SI joint itself. I've spent the last 15 years helping thousands of patients get lasting relief from their SI joint pain dysfunction using my 3-step treatment plan, which includes number 1, consult, exam, and Xrays. Step 2, the chiropractic adjustment, and step 3, stretching and stabilization exercises. Let's go into each step in more detail. So step number 1 is going to be a consultation, examination, and Xrays. So with every new patient, I always start with a consultation where I sit down with them and I ask them a number of questions like the location of their pain, how long the pain has been going on, have they been involved in any traumas like a slip and fall or a car accident, maybe any activities that cause their pain to get worse or any activities that they do that help the pain. All of this gives me very important information to be able to determine the exact cause of the pain. After a consultation, I'll do an examination. I'll start with some range of motion of the lower back and see if any of the motions are causing any increased pain or if any of the motions relieve your pain. And then I'll move on to a number of orthopedic tests, which are designed to stress different areas of your spine, your pelvis, or your hip in order to determine if the pain is coming from the low back, the SI joint, or the hip joint itself. And then after the examination, we'll likely move on to some Xrays, where I'll take an X-ray of the lower back and pelvis area. This gives me an idea if the pelvis is shifting out of position, which can lead to pressure onto the SI joint, which puts pressure onto the nerves, leading to pain. Now, once we've done a consultation, an examination, and X-rays, we've determined the exact cause of your pain. We move on to step 2, which is going to be the chiropractic adjustment. So as a chiropractor, the most important thing that we do is the adjustment. And this is where, in most cases, I use my hand to start to realign the pelvis to help relieve pressure off the nerves, to help relieve pressure off the SI joint, to get that pelvis in a proper position. This helps relieve your pain and helps keep the pain from coming back. And then step 3 is going to be stretching and stabilization exercises. Now, I can adjust you every day, all day long, but unless you're doing some stretching and strengthening exercises at home, the pain is likely going to keep coming back. So I usually start my patients with SI joint pain with stretches for the hamstrings and the hip rotator or glute muscles. Most of my patients sit behind computers all day long, and these muscles naturally become tight. When they're tight, they pull the pelvis out of position, which can lead to SI joint pain. So we want to start with stretching your hip rotators and your hamstrings. Then we'll move on to stabilization exercises for the core and lower back. We want to help strengthen the muscles around the pelvis. So we'll start adding in exercises like a plank, a glute bridge, or a bird dog. All of these are designed to really help strengthen the core and muscles around the pelvis, to hold the pelvis in a better position, to make sure we relieve any pressure on the SI joint and make sure the pain doesn't keep coming back in the future. These are the same steps I used with my patient Travis, who presented with what he believed was right hip pain. The pain worsened when he was seated for long periods, which made it difficult to complete his work since he sat behind a computer all day long. He also noticed occasional pain that radiated to his right buttocks and down the thigh. The pain affected his ability to continue with his normal weightlifting routine, and simple tasks such as bending over became harder and harder for him to do. He tried over-the-counter pain relievers, which didn't provide relief, and he was worried that he might require surgery to help with his pain. After a thorough examination and Xrays, I was able to determine that the source of his pain was his SI joint, not his hip as he originally thought. This gave us a clear direction for treatment. Through a series of adjustments over a few weeks, we were able to significantly reduce the inflammation and realign his SI joint. Travis reported pain relief after just a few treatments and gradual improvement in his mobility. I then created a customized stretching and stabilization plan to strengthen the muscles around the SI joint. Travis began to feel more stable, with less pain, and was able to sit for longer periods while at work. Within weeks, he was back to his normal activities, including his regular weightlifting routine, all without pain. He experienced significant improvement in overall pain levels and mobility, and by the end of his treatment plan, he was able to sit comfortably at work throughout the day without using medications, and his fear of needing surgery was gone. Today, Travis follows the same home care exercises to maintain stability and prevent further issues. At the end of this video, I'll refer you to a video demonstrating some of these SI joint exercises. If you've been struggling with lower back or hip pain and aren't sure where it's coming from, hopefully this video has helped clear a few things up. Remember, identifying the right source of your pain is key to finding the right solution, and you don't have to rely on medications or surgery to feel better. If you have any questions about the SI joint, leave them below in the comments. If you found value in this video, please like and share it. It helps more people discover the channel, and the YouTube algorithm loves that. And remember to subscribe to my channel for more tips and strategies to help achieve lasting relief, improve your mobility, and regain control of your life, all without relying on medications and surgery. In the meantime, if you want to get started with some home-based exercises for relieving SI joint pain, go watch this video next.